Good afternoon, Mobile Cap Inc. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence I chose nursing as my career.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. Please start your OET-speaking roleplay.
Good morning, Mihiraa. I can see you've been through quite a lot, and I'm here to help you through your recovery. My name is Mobile Cap Link, and I'm one of the nurses looking after you. First, I'd like to confirm the reason for my visit. I'm here to check your vital signs, examine your wound dressing, and assess how your recovery is progressing. How have you been feeling since the surgery?
Oh, hello, nurse. Thank you for asking. I've been feeling quite sore, especially around the wound area. It's been uncomfortable to move around, and I'm a bit worried about how long it will take to heal.
Mihiraa, I want to take a moment to reassure you about the pain you're experiencing. It's completely normal to feel some discomfort after abdominal surgery, and you're not alone in this. Pain is a common part of the healing process, but it's important that we manage it effectively to keep you as comfortable as possible. If the pain becomes too intense or doesn't improve, we can inform your doctor, who may adjust your pain relief medication or prescribe appropriate antibiotics if there's any sign of infection. To help us better manage your pain, it's important that you communicate clearly with your doctor about how you're feeling. For example, let them know the level of pain you're experiencing, whether it's mild, moderate, or severe, and when it occurs, such as during movement or at rest. Also, describe the area where you feel the pain most, like around the incision site or elsewhere. This information will help your doctor tailor your treatment plan to your needs.
Sure, I will. How about my dietary regimen?
Definitely, Mihiraa. Now let's talk about your diet, as it plays a crucial role in your recovery after surgery. Eating a balanced diet is essential because it provides your body with the nutrients it needs to heal and regain strength. Focus on including high-protein foods in your meals, such as lean meats, eggs, beans, fish, and dairy products like yogurt or cottage cheese. Protein helps repair tissues and promotes wound healing, which is especially important after surgery. Staying hydrated is equally important. Drinking plenty of water helps your body function properly and supports the healing process. Aim to drink at least 6 to 8 glasses of water a day, unless your doctor has advised otherwise. You can also include hydrating foods like fruits and vegetables, which are rich in vitamins and minerals that boost your immune system. It's also a good idea to avoid heavy or greasy meals, as they can be harder to digest and may cause discomfort, especially while your body is still recovering. Instead, opt for smaller, more frequent meals that are easy on your stomach. Foods like whole grains, steamed vegetables, and soups are gentle and nutritious options. Do you have any questions or concerns?
Yes, this is my first surgery. Could you provide some guidance on wound care?
That's a great question, Mihiraa. Let's talk about how to care for your wound to ensure it heals properly and to reduce the risk of complications. First and foremost, it's important to keep the wound area clean and dry. This helps prevent infection and promotes healing. You can gently clean around the wound with mild soap and water, but avoid scrubbing or rubbing the area directly. After cleaning, pat the area dry with a clean towel or gauze. Don't rub, as this could irritate the skin. Your wound dressing will need to be replaced periodically, and we'll provide you with clear instructions on how often to change it and how to do it safely. Always use clean hands or gloves when handling the dressing, and make sure the materials you use are sterile. If you're unsure about how to change the dressing, don't hesitate to ask for help from the nursing staff. Do you have any concerns?
I'm a bit nervous about my recovery. Will it take too long?
It's understandable to feel nervous about your recovery. Everyone heals differently, and it's natural to have some concerns. Mihiraa, let's talk about your recovery measures. It's important to gradually regain mobility, starting with gentle movements as advised by your healthcare provider. Moving regularly, even in small ways, can prevent complications like stiffness or circulation issues. Breathing exercises are also essential, as they help keep your lungs clear and reduce the risk of complications. Taking slow, deep breaths and following any specific techniques recommended by your care team will support your recovery and overall well-being. While it's natural to want to resume normal activities quickly, avoiding heavy lifting and strenuous tasks is crucial to prevent strain on your body. Your healthcare team will provide personalized activity guidelines, and following them carefully will ensure a smoother healing process. How does that sound to you?
I'll follow as you suggest, but I'm worried about complications during recovery.
I understand your concern, Mihiraa. It's important to keep a close eye on how you're feeling as you recover. If you notice anything unusual, such as a fever, increased pain, swelling, or redness around the wound, it could be a sign that your body needs extra attention. These changes are not always serious, but they are worth mentioning so we can ensure everything is healing properly. Please don't hesitate to let the nursing staff know if anything feels different or concerning to you. Your comfort and well-being are our priority, and we are here to support you through every step of your recovery. If you have any questions or worries, no matter how small they may seem, we are happy to listen and provide the reassurance or care you need. Do you have any other questions or concerns before we begin the clinical observation?
No, I think that covers everything for now. Thank you for explaining everything so clearly.
You're very welcome, Mihiraa. I'm glad I could help. Before we start, may I have your consent to begin the clinical observation and check your vital signs?
Yes, that's fine. Go ahead.
Thank you, Mihiraa. Let's get started.